In this video, we will briefly discuss the differences between membranous nephropathy and membranoproliferative glomerulonephritis. In exams, they commonly ask you to explain the difference between these two diseases, and this is also important for conceptual understanding of these two diseases, whose name appears similar, but they are actually very different. So whenever you are asked about the difference between membranous nephropathy and membranoproliferative glomerulonephritis, you have to think in three main points. First is the difference in pathogenesis of these two diseases. Second is the difference between the pathological features of these two diseases. And the third is the difference in clinical presentation of these two diseases. So as far as the pathogenesis is concerned, you know that both of these diseases are caused by circulating immune complexes. But in membranous nephropathy, the deposition of these immune complexes is at the level of subepithelial position. But in membranoproliferative glomerulonephritis, the deposition of these immune complex deposits will be at subendothelial position. So this is the main difference in the pathogenesis. Now coming to the histopathological features, we studied that the keywords for membranous nephropathy were membranous podocytopathy. Membranous implies thickened glomerular basement membrane, and podocytopathy means that there will be subepithelial deposition of immune complexes. This will appear as spike and dome pattern. Remember that in membranous nephropathy there is no words such as itis, so there are no inflammatory cells in this disease. Now for membranoproliferative glomerulonephritis, the keywords are membrano, which means thickened glomerular basement membrane, proliferative, which means proliferation of endothelial and mesangial cells. Third is glomerular deposits, which means subendothelial deposits. And the fourth keyword is itis, which stands for inflammatory cells that are neutrophils and monocytes. And these two features, that are proliferative and itis, are present in membranoproliferative glomerulonephritis but are absent in the histopathological picture of membranous nephropathy. Now lastly, for clinical presentations or clinical features, you know that in membranous nephropathy the damage occurs at podocytes level, so it results in nephrotic syndrome. While in membranoproliferative glomerulonephritis, the focus of injury is endothelial cells along with basement membrane, so it can present either as hematuria or proteinuria or combined nephrotic-nephritic picture. So these are the main differentiating features of membranous nephropathy and membranoproliferative glomerulonephritis.